Hi, everybody. Welcome to week 8. All right, week 8, integrity and ethics. What a huge topic, either in the clinical setting or in academia. There's a few things I want to talk to you about with ethics, and I want to share with you a few different things. So, I've been the dean of a couple of nursing schools, and they've been a little bit on the smaller side. So my first dean position, I went up and took over a struggling program. They were not doing real well with their NCLEX pass rates, and they were at the point of getting ready to seek national accreditation, and I could see the different things that need to be done with the program. So I went in, and the campus president gave me kind of full reign. I really worked hard with the faculty. We really built up the program, and we set decent but fair admission criteria, and we got our pass rates up into the 90%. We passed our national accreditation, and things were going really, really well. Well, at this point then, I think our campus president got a little greedy, and I started seeing students coming through the program that weren't quite meeting those admission criteria that we had set. Also, I found out that our admissions counselors, when we had students who didn't meet the criteria for nursing admission, would encourage them to go through the medical assistant program. And they said, well, if you get through the medical assistant program, then you have a better shot of getting to the nursing program. That I agree with, that's true. Unfortunately, the medical assistant program was like $20,000 to $30,000. That was before they even got into the nursing program. So I had some ethical issues, really worked hard to try to address them, to no avail. So unfortunately, I had to part ways with that institution. So there are some unusual things that come up that way in academia. Other things are favoritism. Subconscious or conscious. We all like students better who are engaged and participating and doing their work. It's one of those things. We try not to have favorites, and I love talking to everyone in my class, regardless of how little or how much they're participating. It's really fun. But we need to be really, really sure that this favoritism does not get reflected in our grading. For instance, when I'm reviewing a test, okay, and I look at the results and statistics of a test, I just look at scores. I don't look at names attached to them. And I start reviewing questions where 50% or greater of the students got the question wrong, or the statistics for the question looked really bad. And I don't look at any student names until I've really gone through the whole test and determine if I'm going to accept any answers, if I'm going to throw out anything, and then I attach the scores to the names so that my personal relationship with students doesn't in any way impact me as far as when I'm making decisions about grades. So that's something we need to kind of keep in common. And I think sometimes this comes up in clinical education too, where we have favorite students or maybe favorite new nurses that we're orienting. We don't want anybody to get the impression that we're giving any favoritism towards any of those people. So I think that's something we need to consider. Also, when we're looking at teaching, whether it's patients or staff or students, we really need to maintain integrity as far as what do they really need to know, not what do we really like to teach. I've seen some instructors spend lectures on different components that are very particular to a specialty and are too focused, too specialized for a general nurse, and because they really like to talk about them. So you need to be careful that way. And then I'm attaching an article on servant teaching, like servant leadership, but within teaching. There's an interesting section there on judicious, I think the whole article is interesting, but judicious use of power in your position. Because as educators, you do have power. whether people are successful or not, and how much you want to put into your teaching, and how much leeway you allow people. So I think integrity and ethics is something that does come into play, regardless of the area of nursing education that you're participating in. Okay, so week 8, it's an even week, so we've got NEPD due this week, and then we're rapidly approaching our test analysis assignment. I'm hoping that all of you are getting your test ready and distributing out to your peers. Please remember the test goes to peers, not students. It doesn't work to give this to students. And I honestly can't remember if I've posted information yet about calculating statistics to answer questions on the test. If not, or answer questions on the test analysis paper. If not, I will be posting those. And just be sure as you're going through the week 10 assignment that you ask me any questions. If something's unclear for you, that you ask me. It's a fair amount of grade points that are for that assignment. I want you all to do well. It does, again, include chapter 26 from a previous book, and you really do have to have that book in order to correctly format information, and there's some good stuff in that book that tells you about doing test questions. All right, so I look forward to talking this week more about ethics and integrity and about servant teaching. All right, I'll see you in the main forum. Bye-bye.